Hello and welcome back to my YouTube channel. In this short video, I'm continuing the YouTube series on functional medicine. And in this video, we are going to address the question of how does functional medicine work? And in my first video, which you can look, I think you probably need to go here, you can understand some of the differences between functional medicine and conventional medicine. And the best way to explain how functional medicine works is to start with a story. And a patient of mine came in with a diagnosis of hypertension. And as you know, these are a series of numbers that reflect what our blood pressure is. And once you get a blood pressure greater than 130/90, you're deemed to be hypertensive. Now, if you are going to go to your conventional doctor with a diagnosis of hypertension, what's going to happen? His or her nurse will check your blood pressure. You'll sit with him or her in their office for a matter of minutes, and you'll leave with a prescription to reduce that hypertension with an antihypertensive drug. It's that simple. Because remember, from my first video, I reviewed the fact that conventional medicine is stipulated on assessing a diagnosis and then simply picking a drug to combat that diagnosis. There's no question as to the root cause of the symptoms. There's no question as to what has gone wrong with our physiology, our biochemistry, or our anatomy to precipitate this symptom. And this is where functional medicine really begins to differ, and I believe shine relative to conventional medicine. So let's look at the diagnosis of hypertension. Now, as I mentioned, in conventional medicine, you get a drug. So in functional medicine, let's look at this a little differently, because there is so much data out there that shows that hypertensive disorders, again, defined by an elevated blood pressure, is associated with any number of different nutritional deficiencies. And I can guarantee you that there are probably 5,000 papers out there associating low vitamin D levels with hypertension. There are probably just as many papers associating low levels of the anti-inflammatory omega-3 fats and hypertensive disease. So the first thing that we need to do is to address nutritional status. There are a number of measurable nutrients that could be replaced to help to improve your hypertensive disease. But what about things like stress? I mean, there are probably 10,000 studies out there that look at the relationship between stress. And when I think about stress from a functional perspective, I'm thinking about cortisol and adrenaline, because these hormones, in reflection to a thought generated in our minds or a perception of stress, raise our body's blood pressure, cause constriction of our blood vessels peripherally, and put excessive strain on our heart. This is ultimately leading to cardiovascular disease and heart attack. We also need to be thinking about other hormones such as thyroid and insulin, which are all clearly associated with hypertensive disease. Now, what about our gut? I mean, again, if I were to look up gut and hypertension, there have probably been 5,000 papers written that have associated dysfunctions in our gut with hypertensive disease. And don't get me started on toxins. And finally, we can see that there are a number of different hormonal deficiencies that increase an individual's risk of hypertension. So from the start, you can see that in just this short cursory review, that I've evaluated any number of different interventions that could be evaluated to assess what are the causes of hypertension. Because if we can address the causes, we can improve the nutritional deficiencies, we can work on stress reduction techniques, we can optimize hormones, then we can begin to turn around these diseases and just not pad the pockets of these pharmaceutical companies which are selling us drugs that all have side effects. So part of this is learning how to evaluate our environment, our biology, and actually the way that our mind works holistically. Because once we begin to address all three of these different components, then we can begin to reverse diseases, we can begin to stave off cardiovascular disease, stave off this scourge of Alzheimer's disease that is affecting so many people in industrialized countries, and autoimmunity as well. In the United States, something like 10 to 15% of people do have evidence of an autoimmune condition. Once we start to deconstruct the complexities of the human body into a set of measurable, definable, and then actionable steps to turn around that person's health, they start getting better. So that's what I'm trying to share with you guys, is that we can address these in a systematic approach. We need to deconstruct the body into a set of systems, and I've already alluded to those in this video. That's our nutritional state. That's the way the body manages energy with insulin, cortisol, and thyroid. That's the integrity of our barriers, namely our skin and our gut and our lungs. It's the ability to detoxify, and it's the ability to maintain balanced sex hormones. And all of this is wrapped in the need to lower our inflammatory stimuli across all other aspects of our biology. In the next video, I'm going to go over why functional medicine is unique and dive a little further into how it differs from conventional medicine and some of the interventions that we can take to optimize your health without using drugs. And as always, I'm Scott Resnick, a medical doctor who believes that you guys are the future of medicine. Be sure to like, comment, subscribe, share these videos with your friends if you think that they're valuable. What I'm hoping to do is to generate a grassroots movement whereby you become such well-educated representatives of your health that we can begin to turn around this juggernaut of allopathic medical care with a more sensible way of approaching our health. As always, I'll see you guys in another video, and take care.